Hey guys, welcome to another Lifestyle of Eden podcast. Today we're going to be answering the question, what is functional medicine, right? Especially because on my social medias and on my podcast, I talk about my practice being a functional nutrition or functional medicine practice, right? And we're going to kind of get deep into this from all different angles, give some examples, some things that I see with clients and how I deal with it, how I deal with these issues and so forth. But functional medicine really is broken down into two concepts: nutrition and supplementation. And supplementation can also mean prescriptions and stuff. So we'll kind of get into that and everything else. But like I said, my practice, Lifestyle of Eden Training and Nutrition, is a functional medicine practice. And the definition of functional medicine, right? What's the definition literally of it? The definition of functional medicine is we take care of root causes, right? We don't deal with symptoms. And what I mean by that is we don't deal with symptoms alone. Many people, they say, oh, I have a headache. Let me just take something for the headache. Well, that's fine. You're dealing with a symptom. But why do you have the headache? Oh, you're dehydrated. Well, then let's rehydrate and let's make sure that we don't step back into that so you don't have to keep taking Advil every day, right? Or, all these different things, which we'll kind of get into these different issues and some examples of it. But basically, we want to take care of the root cause. If you have certain issues, like for example, one of my clients just today or just last night messaged me, said, hey, Nick, I've gotten sick 3 times in the last couple of months. This has never happened before. What's going on? Well, I know this client because, some stuff that's going on with him because he was actually one of my clients where we dealt with his gut microbiome. And then after we got him healed and stuff, he kind of went off and did his own thing for a while. And so for the last couple months, since I got him healthy, he's actually been doing his own thing. Well, I don't know the stuff that he's been doing in and out of his life and so forth, but I had said, oh, this is a immune system issue, specifically your immunoglobulin A, your IgA within the gut microbiome. And we had to deal with these different things. So we're going into the root and we're taking care of those different things. Now, like I said, how we take care of these things at the root. Well, functional medicine is broken down into nutrition and supplementation. And whenever I say supplementation, not only do I mean like pharmaceutical products as far as their grade and supplements is as far as different vitamins, minerals, different compounds, mastic gum, antimicrobials, all these different things. But I do also mean prescriptions. There are times where the prescriptions are necessary for us to use. And we'll kind of explain some things with that. So, a couple of examples. Whenever I'm working with clients, right, there might be an issue that's going on. For example, one of my clients in California, she has an autoimmune disease. She has major gut issues. We're getting her GI map now so I can evaluate that. I just got her blood work, but we're getting her GI map now so we know exactly what we're dealing with. I can write a 5-hour protocol. But within her blood work, I remember right off the bat, on her RBC panel, she's got all of these, deficiencies. It showed microcytic anemia, which has to do with either B12 or folate, or it can deal with iron. Her calcium's low, all these different things. Then we get later in her blood work, and sure enough, her iron's low, and this is low, and this is low, and this is low. And she asked me, she said, Nick, should I be taking a supplement for this, like an iron supplement, a folate supplement, B12, and this, that, the other? And I said, well, I go, yes and no. I go, somebody that is just kind of a quick trigger or less experienced in this might say yes. And the reason they're going to say yes is because, well, yeah, you're low in this. Why not do this? But you have to notice the theme here. You're deficient in all these issues. This is not, oh, I'm just low in this vitamin. Like many people will be low in vitamin D, right? And so you got to supplement a vitamin D supplement. That's very common. 9 out of 10 people need that. I might even say 10 out of 10. But when it comes to all these issues, like she's got this low, this low, this low, this low, this low, this is not, hey, let's just get on a vitamin protocol. This is a malabsorption issue. This is a malnutrition issue. What's really going on? Your gut health issues. You could have leaky gut where you have your nutrients seeping out of the gut microbiome, your body's not absorbing it. Or you could have parasites that you're eating and taking these things, but the parasites are actually absorbing the nutrition from the host, from you. Or you could have things with SIBO or gut dysbiosis where your body is not extracting nutrients properly. This is a gut microbiome issue. Notice the theme of all these things. The symptom is that, oh, you're deficient. Sure, I can feed you all these different things, but even if I feed you these different things, you're having a malabsorption issue. So you're still not going to be even absorbing the things that I'm giving you, right? Or if you have high insulin, your body's not going to be receiving the things that I'm giving you. Your cell wall is hardened and so forth. So what do? We say, hey, the root cause is that you have a gut microbiome issue. So let's take care of the gut issue. We're getting the GI map. We're going to take care of the gut issue. And by taking care of the gut issue, I'm taking care of the root cause. Things start to seal up. The malabsorption starts to simmer down, and those levels start to become healthy and rise up, and the blood work begins to heal. Same thing with your inflammation. Same thing with your cholesterol. Same thing with all these different things. So whenever it comes to the functional medicine practice, that's what we're looking at is, okay, this is a symptom, this is going on, but why is this really going on? What are the triggers that would cause this? Okay, let's get to that so that this goes away and so that we don't just have to put you on medications forever and just add on medications and medications and medications, which in turn are going to end up exacerbating issues more later. But, another one was this, cholesterol, right? I talk about this a lot with cholesterol is cholesterol is an inflammatory marker. Right? When you have high cholesterol, specifically your high LDL, which is bad cholesterol, when I see that that's high, I immediately start checking other things in the blood work, right? I start checking the cortisol. I start checking the insulin. I start checking different things with A1C. I start checking vitamin D. I just start going throughout. I check your CRP, your C-reactive protein. I'm checking these different inflammatory markers. And generally, those things are going to be off too. And the reason being is because inflammation is literally an inflammatory response, okay? So when you have high LDL, right, high bad cholesterol, there is inflammation in the body, and the LDL is trying to basically help the situation. So we look at LDL as the bad guy, and that couldn't be further from the truth. LDL is like the fireman. So say this house is on fire. And firemen, just tons of firemen are running all through it. I'm not going to look at the house and go, hey, the firemen are the problem. No, the firemen are trying to put out the fire and the heat's from the fire within the house. The same thing with LDL. You put out the fire, the firemen don't have to really be here. The same thing with the LDL. There is inflammation and fire within the body, and the LDL is having to be exacerbated and exercise greater force in order to put out this fire. So we have to think about what LDL and HDL do. Cholesterol comes from the liver, right? So your LDL, what its job is to do is to take the fat that's running through your vessels, running through your arteries, and it's to deposit that fat into the cell so the fat doesn't build up. Well, then after that, the HDL is like the pickup truck or the trash man, and it goes and picks up all the cholesterol within the veins, and it returns it back to the liver. So the more fat and inflammation that I have within your blood vessels and so forth, the more cholesterol has to come out. LDL, bad cholesterol, has to come out and try and deposit these things into the cell. Well, why is the fat not being there? Well, it could be because of a bad diet, right? You're eating a terrible processed food diet that's causing a lot of fat and atherosclerosis and plaque buildup in the regimen. Or you could have certain inflammation that's raising insulin and making you insulin resistant and having high blood sugar, and it's building up these different things in your blood vessels. Whatever it is, but it's all inflammation based that's causing insulin resistance, and so therefore your LDL is going up and so forth. And then if people don't have the HDL to be able to remove some of these cholesterol levels, then that exacerbates the issue even more. So what do? We don't just go put you on statins. We say, hey, what's the inflammation issue? What's going on? Why are you inflamed? A lot of the times it's a gut issue. So we deal with the gut issue. And then as we deal with the gut issue, guess what? The inflammation comes down. The insulin resistance comes down. Insulin sensitivity comes up. And naturally, the LDL comes down. So you start to deal with the root issues, not going on statins, which are actually worse for you than even your cholesterol in the first place. Okay? So it's all about focusing on these root causes and the different things that's going on. And the reason that I like to say that it's also nutrition supplementation and sometimes prescription is I will use prescription-based things because I'm connected with a clinic where, they know me very well and my clients. And so if my clients go to them and they say, hey, Nick wants us on this, that, and the other, they'll generally prescribe you whatever it is, So I have certain clients where they'll come to me and their insulin levels are just through the roof, over 20. I mean, just unbelievably through the roof. Like, you are coming close to being a type 2 diabetic. And so there is a drug called metformin, which metformin is actually phenomenal for many reasons, but it also lowers your insulin. And so for sure, I'll look at the blood work, I'll look at the GI maps, and I'll go, hey, we have a gut issue, we've got this, we've got that, but hey, your insulin's through the roof. So hey, I think for right now, maybe some people, I do this, some people I don't, but hey, maybe right now we need to get on some metformin, like 500 milligrams a day. But this is just a Band-Aid while we deal with the issue. We're putting a Band-Aid on the symptom to simmer the symptom so it doesn't cause any more issues right now. But I'm going to take care of the things with your diet and with your gut and with this, and this. And while we deal with this, after that, the insulin's going to come down naturally and we're going to get you off the prescription. I don't want you on the prescription as an answer. It's just a Band-Aid because functionally I'm dealing with the root, but I have to use this just for a moment, just temporarily while I deal with the root, right? Or another big example would be, some people with gut issues, their IgA, their immunoglobulin A, which is the number one defense system of your immune system within the gut microbiome. It's a protein in the immune system, right? That will be like through the roof. Through the roof. And if it's through the roof, it is causing so much damage to your body. Your joint pain, you're swollen, you can't sleep, anxiety, depression, insomnia. I mean, it's going to wreak havoc on your body. Why is it doing that? Because there's an invader within the gut microbiome. Well, that's probably going to take me an 8-week protocol to truly be able to fix at the root, which I can do it, but it's just going to take, 8 weeks or so. Because those things didn't come on in a day, they're not going to leave in a day. But we've got to get on a protocol of 5R and we've got to take care of it. Well, while we're taking care of it, the immune system is still causing major issues for the client. So what do? We have a couple different things. We have something called rapamycin, which is immunosuppressant. It also induces autophagy. It's a phenomenal drug. Or we have low-dose naltrexone, right? And so depending on the situation, like if it's just you're a regular person with a gut issue, I might say, hey, let's go on some rapamycin. I'll send them to the clinic, get them a prescription for that, put them on the rapamycin, and it'll manually lower your immune system back to normal while we deal with the gut issue. So while we deal with the gut issue, then naturally the immune system is going to come down because it's not seeing invaders, and then we can come off of the rapamycin. But we're just doing that as a Band-Aid so it doesn't wreak more havoc for you in your daily life than it already is while I deal with the issue. Or LDN, low-dose naltrexone, if somebody has like an autoimmune disease, right? This is low-dose naltrexone, LDN, is an extremely good drug for different things, for anxiety. It's been shown for ASD, autism spectrum disorder, autoimmune diseases, all these different things. But while we're dealing with some of these issues, like I have a client, for example, she's got an autoimmune disease, major gut health issues, blood work was just horrendous, and her CRP is like at 10, okay? Her CRP is at like 10. She's in her low 40s, and her LDL is high. She's a ticking time bomb. Like, at any moment, like, there could be a heart attack, literally. So I told her, I said, okay, look, I've got to write your protocol, and I've got to get your gut health issues fixed up because your immune system and your CRP is literally through the roof right now, and you have an autoimmune disease that we're working with. Her immune system's off. That's the whole thing. The immune system is off with everything. That's the autoimmune issue. But it all stems back to the gut. Leaky gut is the root cause of every autoimmune disease, right? So I'm having to deal with all of these issues. But for right now, because she's literally a ticking time bomb and could go off at any moment, I mean, her CRP is at like 10 and her LDL is high. So what did I do? I sent her to the clinic and I said, here's your nurse practitioner. Message her, say this, Nick said this, and this. And, we'd like to get you on LDN, low-dose naltrexone. Why? Because it's going to lower that for right now and keep her in a safe zone so she's not a ticking time bomb while I deal with the root causes and the stuff I have to deal with, because once this is dealt with, that's going to come down naturally. Then punt the LDN and we're good, and we can knock out each thing like a domino effect. But this is not something, hey, let's just go on prescriptions to go on prescriptions, because then you're just spending money long term. These things are not going to be healthy long term. You're just wreaking more havoc and more havoc and more havoc. And this is the reason why my practice focuses on the functional route, because eventually all of that stuff is going to catch up with you. Here's another thing. One of my clients, their father died of kidney failure. And I asked him, I said, was he a type 2 diabetic? They said he was. I said, okay. He was a type 2 diabetic. They put him on metformin. They put him on this, and this, and this, and this, and they put him on all these drugs. They never fixed the root issue. Type 2 diabetes, let's just be clear, is 150% completely and totally reversible. Completely and totally reversible type 2 diabetes. Okay? So they were putting him on all these prescriptions rather than fixing the root causes of his nutrition, of his supplementation, of his stress, of his inflammation, of his daily lifestyle, all these different things. And all we're doing is putting them on prescriptions, and eventually you just do that and you keep them dealing with the same issues they're dealing with. Yeah, guess what? They have kidney failure and they end up passing away. All because we didn't deal with the issues. Like I said, we might put them on certain things like metformin just to lower the insulin while I deal with these issues for the next several weeks, so that you can get off of that and you can go out and live your life a healthy person. And that way your kids don't learn from it, and it's not a generational curse going forward. But this is why I say that I believe functional medicine is the present. I believe it's the future. And I believe it's what the past has really been missing, is because we are dealing with a root cause, not a symptom, which in turn is just going to breed more meds and more meds and more meds and this, that, or the other. But the same thing goes with weight loss resistance, right? You have to fix the root cause when it comes to your weight loss resistance. So many people will go on these fad diets, or they'll get these surgeries, this, that, and the other, but you're not fixing the root cause. You're not fixing the fact that you probably have metabolic syndrome of some sort, that you probably are having thyroid issues, that you are probably no longer a fat burner, you're a sugar burner. Your adrenals are totally out of whack, your adrenal fatigue, your hormones are off, all these different things. I tell people this all the time. My body, with how lean I've gotten and how I continue to get leaner every week, I actually burn more calories and eat more food now than, say, what I did 4 months ago, right? Why? Because over the last year, I have gone in and I've dealt with things at the root level. So I have totally upregulated my thyroid. I've done so much autophagy where my cells have been totally cleaned out. There is cellular cleansing. Inflammation has been removed from my cells. My body and my cells at the cellular level are using hormones incredibly. I'm extremely sensitive. Nutrition is incredibly sensitive for me. My pumps and training are incredibly sensitive. My thyroid is totally upregulated. My hormones are, in such a good spot. All these different things. Why? Because I've gone and I've dealt with things at the root. And so now I'm also an incredible fat burner. My body burns fat very well. There are a lot of people, because of the choices they've made throughout their life, that their body no longer burns fat. They're what we call sugar burners. Okay? And in medical literature, there have been doctors that have actually said your lifespan can actually be determined on how well you're a fat burner versus sugar burner. Somebody who's a sugar, there's a saying in the nutrition world, fat is burned in the flame of the carb. Carb is the flame that gets the metabolism going. But after that, about an hour after you eat, your body should start burning body fat. There are many people that they'll eat a carb meal and their body only runs on carbs and sugar. Then after the carbs and sugar is burned up, they get very tired and these different things because their body doesn't switch energy sources to the body fat. And it's only being able to burn based off of the sugars and the carbs in the body. Their body doesn't switch over to body fat. They're not burning fat. So you have to reteach at the root level. You have to fix the root. It's not about going on some fad diet or cutting your calories. That's what a lot of people do. It's a calorie restriction stuff to where now not only are you calorie restricted and you hate it, it's not sustainable and maintainable weight loss. 80% of people gain 90% of their weight back on these yo-yo diets, but it's because also you're actually slowing down your metabolism. 10 weeks into the program, these people are actually burning 700 less calories than they were before because it's a calorie restricted diet and you're slowing down the metabolism. The thyroid's not high, this, that, or the other. The people that come to me, the men are able to eat over 3,000 calories. The women are able to eat over 2,000 calories. That's 1,000 calories more than each of them were eating before. And they're still burning fat because I've upregulated their thyroid, their hormones. I've turned them back into fat burners. You have to fix the fat burning, sugar burning scenario, which comes a lot, which I'll have another podcast on, which generally is coming through fasting, fast mimicking diets and so forth. But either way, you've got to deal with the roots. Many people will have a hard time losing fat, and there's many reasons for that. Is that a hormone issue? Is that a gut issue? Is that a sugar burning issue? What's the reason for that, right? But that's what it's all about, is getting to those roots and getting healthy at that root level so that your body is actually burning more calories than when you started. You're healthier than when you started. In fact, you might even end up healthier than you've been in your entire life. My body actually burns things better at 30 years old, like I am right now, than I ever have in my life. Same with bowel movements and all of these different things. That's really the goal. I'm able to step into my 30s saying I'm going to be healthier than I ever was in my teens or in my 20s. Because quite frankly, it's not like I grew up in a health family, right? I grew up eating Gushers and, all these different things every day, and pizza rolls, which, they were delicious, but nevertheless, this was the stuff I grew up in, right? I didn't get into health until I was about 15 or 16 when I got very, very overweight at a dangerous level. And so I had to step up and do these things myself, and I've kind of paved my own path with that, and I've been able to really, I think, impact a lot of people with family, friends, colleagues, clients, other mentors, and so forth. But if you don't get to the root cause, eventually these things are going to drown you in debt because you're going to have to pay for the prescriptions. And over time, those things, you're not going to get away with it. It's just going to build and build and build. And here's the thing, the longer you wait, the harder it is to reverse. It's not impossible, but the longer it takes. So the people that come to me in their 40s and 50s and 60s, and they've gone on these fad diets eating trash, garbage food, and they think it's lean because it's fat-free or whatever, and it's not, or it's sugar-free. It's still trash food. It's processed. And they've taken this, that, and the other. Can we take care of that? Yeah, we can still take care of that. But it may still take a little bit longer. I've got to knock off all these different dominoes and check all these different boxes. So you're just doing more and more damage to yourself. Not only that, you're spending more money. The functional approach, can it be expensive while you're dealing with it? Yes. But the thing is, while you're dealing with it is very short in comparison to the length of time as if you don't deal with it and all the money that's going to be spent during that time. So it's like Muhammad Ali said. Muhammad Ali said, I hated every minute of training. But I said to myself, train now and live the rest of your life as a champion. Many people that are going through certain protocols, like I have people with PCOS and they're near type 2 diabetes and they've got this gut issue like SIBO, H. pylori, dysbiosis, calprotectin. They're getting close to an IBD, inflammatory bowel disease diagnosis. I've got people pre-diabetes with all of that, with prostate issues, all these different things, right? Going on those protocols to take care of those things, sure, it may be taxing financially, it may be taxing energy. Oh, I can't go out with my friends, I can't do this, I can't do that. Yeah, that's fine right now. You may not be able to do those things. But guess what? 1 year from now, God willing, you're going to be in the best place that you've ever been. And you're going to be able to go enjoy those things. And you're going to do it with a clear mind. And you're not going to live those things as a lifestyle. Going out and enjoying food with your family is one thing. But when you're eating out every single day, like I know people that eat fast food every single day, or even 2 or 3 times a week, every week. I mean, this is ridiculous. This is the reason why our children, 1 in 3, are either pre-diabetic or going to have diabetes. This is the rate we're at. And everything is missing nutrition because of the soil. In fact, there was a study that was done that just came out. And it said that back in 1951, we were able to eat 2 peaches and we were able to get the full daily dose of vitamin A. Today, in 2024, we would have to eat over 53 peaches to get the daily dose of vitamin A. Why? Because of the soil alone. the soil is not filled with the nutrients that we need. And our potatoes are lacking more than 50% of the nutrients that they had, all these different things. So it's all of these different issues. You've got to deal with the root cause. Like I said, for me, I genuinely believe functional medicine and my practice, Lifestyle of Eden, I believe that this type of relationship with approach is not only the best for healing, it is also preventative medicine by nature. It is, hey, how do we deal with this? But then, hey, how do we make sure that this never happens again? And hey, if you haven't had this happen yet, then how do we make sure it doesn't? Because you might be on the way where you're on the way there to that sickness or whatever. Let's fix that right now before it happens. Everything is preventative by nature and then curable if something happens. But then once again, we're back into the preventative nature after it's cured. That's actually what a 5R protocol is. A 5R protocol when they have a gut issue is remove, replace, reinoculate, repair, and rebalance. The rebalance actually has to do with lifestyle. Rebalance is having to deal with your stress. Hey, did you get a gut issue because of stress? Okay, let's figure out why you're so stressed in your life, because you can't live life like this anymore. You do this, you're going to come back to the same situation you're in. Oh, hey, you drink 5 days a week and that was what caused this issue? Well, hey, you can't drink 5 days a week. You shouldn't be drinking 5 days a week. Or, hey, you're eating all these bad foods and you're eating ice cream 6 times a week and this, that, or the other. Well, hey, you can't do that anymore. We have to rebalance your life to where you go forward in a preventative way, and we just dealt with things at the root cause. Many people, they have these issues with their gut when it comes to dairy, but they'll just take like some lactose pills, 2 or 3 or 4 times a week. And it's like, you're putting a Band-Aid on something that your body is saying, hey, I'm screaming to you, there is a problem, there is a problem. Whenever the body starts to inflame itself or show symptoms, that is the body's way of saying, hey, Nick, can you stop doing this? Because I have a problem and soon I'm going to shut down. Soon this is going to cause sickness. Soon as this is going to wreak havoc that I'm not going to be able to fight off for you. No, I'm just going to take another lactose pill. No, I'm just going to take another ibuprofen. Eventually your kidneys are going to fail. Eventually type 2 diabetes is going to come happen. That's why we call it adult onset diabetes. Now we can't even use that phrase anymore because all of these kids are getting diabetes. So the root causes now you didn't deal with, and now your kids are having to deal with. So yes, I do believe that this is the present, I do believe it is the future, and I do believe it is the missing puzzle piece to the past. Not that we never had preventative medicine or functional medicine in the past, but it was few and far between, and it was never as recognized as it is today. The reason it's so recognized today is because what we're even seeing through GI maps is many people are getting antibiotic-resistant genes. And the bacteria that are within our bodies are very intelligent, and they're learning how to become antibiotic resistant. And the antibiotics and these things within the medical field are not getting the job done completely. And so what happens? We have to go to functional medicine, and we have to go around these different things to be able to do certain things that they're not resistant to. Right? Like even with gut issues, there can be many H. pylori infections in people. Like I just had a GI map this week that I read, and I was reading it, and we actually have medications on the GI map that you're tested for within your stool test, and it will tell you which ones you are antibiotic resistant to. She's antibiotic resistant. I said, so these antibiotics wouldn't even help your H. pylori. Only the functional medicine approach that I have will actually help this. But this is happening more and more to where I literally see the Lord utilizing these issues in order to bring us back to a more functional approach, back to a lifestyle of Eden, a Garden of Eden approach, because he gave us all the healing things that he needs in nature. All of those different things. The only reason we need the prescription in certain things, like I said, if you want to use them as Band-Aids, as I will, sometimes you can. But even then, I just use them because sometimes it can help calm the symptoms. Technically, to get the end result, do I need it? No. No. But can they help? Yeah, they can help. So I literally see this as a prophetic thing that I've shown many times, where we were kicked out of the Garden of Eden and thrust into sin and sickness through nutrition. It was by eating from the tree of knowledge of good and evil. It was by eating something we were not supposed to eat. So we were kicked out and brought into cancer, sickness, and sin through it. So too, in the end of days, God is going to use the nutrition to bring us back into health, back into intimacy with him, back into relationship and into health, and not living in sin and all these different things. It is a full circle. that's coming back. And so God is using this time right now. He's using the sickness. He's using the antibiotic resistance. He's using the loopholes that cannot be filled properly within certain medical approaches. Nothing against the medical field, but there are just certain approaches that may not be getting the job done, or dealing with things at the root, right? It's just dealing with the symptom and putting a Band-Aid. He's using those things right now to open our eyes, to bring us back to the approach that he desires so that we can live healthy and in fullness with him. So if there's anything that you have questions on, if there's any issues that you're struggling with, if there's any root causes that you want to get to, I'd be more than happy to help you. Please email me at lifestyleofeden@gmail.com, and stay tuned for the next episode.